Our topic is blood components, and our group members are Carly Hopkins, Lindsay Smart, John Scholl, and Brittany Ellis. The basic components of blood are the formed elements, which make up 45%, and those are the erythrocytes, or red blood cells, the leukocytes, the white blood cells, and the thrombocytes. The plasma makes up 55% and is composed of H2O, solutes, and plasma proteins. The plasma solutes are the electrolytes, the gases, waste, hormones, nutrients, vitamins, and buffer. Next is plasma proteins. 90% of the plasma proteins are formed in the liver, and albumin is by far the most abundant, making up 60%. Albumin regulates the colloidal osmotic pressure of the blood, and it helps patients with low albumin levels can develop lower extremity edema or third spacing fluid. The main functions of albumin are to transport fatty acids, hormones, and many medications. Next is globulin, making up 35%. Some of globulin is produced in livers and the other is produced in the immune system. The main function is to transport proteins, and it also plays a major role in antibiotics. The smallest plasma proteins are the fibrogen, which make up 4%, and they are made in the liver. Their main function of fibrogen is in blood clotting, and it helps form the fibrin, which acts to stabilize the blood clots in platelet formation. And this picture is just a breakdown of the blood components and their makeup.
Okay, so here is a picture of just the different cell lineages. You can see that all the cells start as a hemocytoblast, and then they differentiate into your granulocytes, your red blood cells, your agranulocytes, which those both make up your white blood cells. And then you can also see that the thrombocytes are also known as platelets, and those are the fragments of the bigger megakaryocyte. So I'm going to be talking about white blood cells. So here, white blood cells are also called leukocytes. And the difference between those and red blood cells is that leukocytes, they have a nucleus, and they are stored in your red bone marrow and also in your lymphatic system, some of the organs there, and then they are released when your body needs them. So they're split up into granulocytes and agranulocytes, and that's according to if they stain with granules or they do not. So the granulocytes, we have the neutrophils, eosinophils, and basophils, and they move from the capillaries to the interstitial fluid by diapedesis, and diapedesis just means that they squeeze through and they go to the next spot. And then you have your agranulocytes, which are made up of your monocytes and your lymphocytes. So your lymphocytes, they are the big player in your immunity, and they are mostly formed in your lymph nodes, your thymus and your spleen, and then some in the red or in the bone marrow as well. And then you have your monocytes, and when they enter into the tissues, they become macrophages, and they circulate for about 72 hours. So now more specifically on granulocytes. So we're going to start out with neutrophils because those are by far the most abundant. They're also known as neutrophils because they stain neutral. They have fine granules in their cytoplasm, and those contain lysosomal enzymes which help fight against bacteria, because that is what they mostly go after, is bacteria. They have a multi-lobed nucleus, either 2 to 5 lobes, and that's why their other name is called polymorphonuclear cells, or PMNs. And they are the first responders, so that's when you have an injury or you need inflammation, they will be the first ones on site to that injury site. They are increased in anyone that's had surgery, is stressed out, has any trauma or infections. The levels will be increased, and they also degranulate and destroy bacteria, so they are also considered phagocytes as well. They only live for a few days, however, and they reside in your blood and your mucus, or your mucosa. And now moving on to eosinophils. They are called eosinophils because they stain with an eosin dye. You can tell it's only 0 to 3%, so there's not that many of them, but they have a bilobed nucleus, and they have, if you look at it look at them under a microscope, you can see really red granules that are pretty large. They are mainly attacking parasites, but they can also attack bacteria, protozoa, and flukes as well. And how they attack them, they release toxic compounds through exocytosis, so they release it from their cell, these toxic compounds. Now basophils, they are less than 1%, so they're the least abundant in circulation, and they eat up damaged tissues. They have large granules as well, but their nucleus is S-shaped, and they are typically seen in allergies. They store histamine and heparin and also some serotonin, so they're important because in inflammation you need more blood to get to that site, so they increase the capillary diameter to promote inflammation. And they also release heparin to prevent clot formation, and then the serotonin will cause vasoconstriction as well. And they also can degranulate when they come in contact with an allergen to promote the inflammatory response. So now we're going to talk about agranulocytes, and remember those are the lymphocytes and the monocytes. Lymphocytes are more abundant. They have a thin halo of cytoplasm. They are involved mainly in viral and foreign antigens. They can also attack cancer cells. They have a very large nucleus, and then they are divided into T and B lymphocytes and natural killer cells. And we know that the T lymphocytes are made and produced in the thymus, and then they differentiate into a lot of different T cells, which we won't get into. And then the B lymphocytes are made and stored in the bone marrow. And you can suppress these by corticosteroids because that suppresses your immune system, and we know that lymphocytes are toxic, or the corticosteroids are toxic to lymphocytes. So now talking about monocytes, they are the largest white blood cell, and their nucleus is oval shape. They are strong phagocytizers, so I think of them as little garbage guys that go up and eat everything. They migrate to certain areas, and then their name changes. So if they migrate to the skin, they're called dendritic cells. If they migrate to the liver, they're called Kupffer cells. And if they migrate into the brain, they're called microglia. But also, just when they go into the tissue, they are now called macrophages, and they just eat up everything, kind of like little garbage men. So that's just a brief overview about your white blood cells.
Erythrocytes, also known as red blood cells. Erythropoietin, made mostly by the kidney, stimulates production of red blood cells, hereby known as RBCs. Erythropoiesis needs adequate amounts of iron, folate, and vitamin B12 to form mature RBCs. Healthy RBC shape is a biconcave disc. This shape creates a larger surface area to allow for gas exchange. Also allows for the ability to bend and flex to move through membranes. RBCs are non-nucleated cells that do not reproduce or make protein or ATP. Their main function is to carry oxygen. A fun trivia fact, it takes less than a minute to leave and return to the heart. The average lifespan of a red blood cell is 120 days. Thrombocytes, also known as platelets, are small fragments of cells, flat discs, originated from megakaryocytes. Production is stimulated by thrombopoietin from the liver, anucleated. Then their lifespan is 5 to 9 days, involved in homeostasis and coagulation cascade. And this concludes our fantastic run through the components of the blood.